Hello friends, welcome to part 4th of cardiomyopathy. So in part 4th of cardiomyopathy, we are going to discuss with the medical, surgical and nursing management of cardiomyopathy. So basically the cardiomyopathy is treated only with the help of a surgery. Okay, so these medicines are only reducing or subsiding the effect of the causes. Okay, so these medicines are given for relieving the cause of cardiomyopathy, not for the treatment of cardiomyopathy. So first medicine we give, that is beta blocker. As the name blocker, it means it is blocking something. So it is blocking adrenaline hormone, which is released from the adrenal gland. Okay, so this adrenaline hormone is also known as fight or flight hormone, because this hormone released in the stress condition, in the fight condition. Okay, so this hormone basically retention of sodium and water in the body, which will increase the blood volume and will increase the workload on the heart. This hormone again increase the heart rate, increase our BP. So we are blocking the adrenaline hormone. Example, acebutolol, atenolol and bisoprolol. So medicines which are ending with the lol, they comes into the beta blockers. So medicines which are ending with the LOL. So we are suppressing or we are stopping the effect of adrenaline hormone so that our BP could be normal. Next we have calcium channel blocker. In this term, the term is coming blocker. It means it is blocking something. So it is blocking the calcium ion. So why it is blocking calcium ion? Because when calcium ion influx into the cell or tissue of our heart, then they will do the contraction process, they will do the contraction force. And again, when this calcium ion enter into the blood vessels, either artery or vein, so in artery and vein, it will do the contraction process and increase the heart workload, increase the heart rate, due to which it again brings the BP high. It means there is chances of high BP by influx of calcium into the tissue or cell. Again, this calcium ion influx into our electrical system of our heart, that is SA node, and it will again brings the irregular heartbeat or arrhythmia condition in the patient. So we are blocking the calcium ion, we are blocking the calcium. So example, amlodipine, nifedipine and nicardipine. The medicines which are ending with the dipine word, they all comes in the calcium channel blocker. Next medicine, vasodilator. Examples of vasodilator are AC inhibitors. Okay, calcium channel blocker is again the example of vasodilator and nitrates. Vasodilator are dilating, okay, they are widening the blood vessels so that the blood could easily flow into the blood vessels and there will be normal BP. So example, AC inhibitors and nitrates. So what AC inhibitor is basically doing? The AC inhibitor is inhibiting or stopping the AC enzyme. So why it is stopping the AC enzyme? Because this AC enzyme converts angiotensin first into the second, and this angiotensin second have many effects in our body. It will increase the sympathetic nervous system, it will increase the adrenaline in our body, and this adrenaline will again retain sodium and water into our body, which will increase the blood volume, which will increase the extra workload on the heart. Okay, and this AC inhibitor also narrow or also constrict the blood vessels and increase the BP. So we are inhibiting, we are stopping the AC enzyme so that angiotensin first will not able to convert into the angiotensin second. Next we have nitrates. Nitrates medicines release nitric oxide. Okay, this nitric oxide will dilate, will widen up the blood vessel and will help in maintaining the BP. Next we have opioids analgesics. Okay, these opioids analgesics are a form of drugs which are taken from the poppy plant. Example, morphine, codeine, mepedipine. These medicines are given for the relieving of pain. Like in cardiomyopathy, the patient suffers from the angina pectoris pain. There is lot of cough production in the patient due to congestion of fluid into the lungs. So we will give the opioids analgesics to the patient, and this medicine is only given in the prescription of a senior doctor in front of the physician team. Okay, so this medicine will release the angina pectoris, means chest pain symptoms. Example, morphine, codeine and mapedipine. Next we have anticoagulants. Anticoagulants medicines will make the blood thin. Okay, it will not make the blood to get thick. So the medicine we are giving, that is warfarin. Why we are giving anticoagulation medicine? Because in dilated cardiomyopathy there is a dilation of ventricle chamber, and due to this dilation a lot of blood get accumulated, accumulated into the ventricle chamber. So for preventing its thickness, we are giving anticoagulation medicine. Next we have thrombolytics. Thrombolytics means thrombus, a clot formation. So if any clot is formed into our body, this clot can do a many effect in our body. Like if this clot travels to the coronary artery, then it can block the coronary artery, and our myocardium cell and tissue will not able to receive sufficient amount of oxygen and nutrition. Again, this clot can travel to our brain and cause stroke condition. So we are preventing the clot formation into our body. The medicine we give, that is streptokinase and TPA, transplasmogen activator, which is given 30 minutes before any surgery, and it is given only by the physician. Next we have diuretics. Why we are giving diuretics? Because due to cardiomyopathy there is a congestion in the lungs of the patient, there is a congestion, there is swelling, edema in the body of the patient. So we have to remove extra sodium and water from the patient body for reducing the edema condition. The medicine, that is Lasix. Next we have cardiac glycosides. These medicines are also called as positive inotropic medicine because they give power, they give contraction power to the heart muscles. Okay, so these are the power medicine which is given to the patient for more contraction, for more extra work, or for more rhythmically the heart can beat. So we give positive inotropic medicine, that is cardiac glycosides, to the patient for normal heart rhythm, for normal heart activity. Next we have cholesterol lowering drugs. Okay, so due to cholesterol formation there can be atherosclerosis, there can be plaque formation in the coronary artery, which will again supply less blood to our myocardium cells and tissue, and if there will be less blood supply to myocardium tissue, then scar or fibrosis formation can happen in the myocardial tissue, and there could be restrictive cardiomyopathy done. Okay, so we are lowering the bad cholesterol, like LDL cholesterol, and due to this medicine we will also increase the HDL, a good form cholesterol, into the patient body, like statins. We are going to study the surgical management of cardiomyopathy. So when all the medical and lifestyle modification are not able to treat this cardiomyopathy, then at the last we do the surgical management of cardiomyopathy. So first surgery we do, that is septal ablation. So septum is the muscular layer present in between the right and left ventricle. As we have read that in hypertrophied cardiomyopathy there is an obstruction, there is a bulge out of the septum region because of hypertrophy of the cell. Due to this bulging out, the blood which is pumped from the left ventricle is not able to reach up to the aorta. So basically what we do in septal ablation surgery, we insert a flexible guide wire from the groin region of the patient into the coronary artery. We will insert the flexible guide wire into that branch of coronary artery which is supplying blood to this septum region. And through this guide wire we will insert 1 ml or 1 cc of pure form of alcohol into this catheter. Okay, we will insert a ethanol in this catheter, a pure form of alcohol, which will make this cell to get shrink. Okay, basically we are giving a shrinkness, we are doing necrosis in that part of septum. We are doing a localized heart attack into that region of septum. And due to this shrinkness, the obstruction have been cleared. It takes some month or some year. And if this obstruction get removed, then what will happen? The blood is easily flow from the left ventricle to the aorta region. Next surgery is myectomy. This again we do in the hypertrophied cardiomyopathy. So treat hypertrophied cardiomyopathy, surgeon removes part of thickened septum. Again we are doing this surgery in young patient. Okay, so the patient which are not suitable for septal ablation, we do the septal myectomy. So we are again removing the obstructed or thickened part of the septum region by the incision or by the cutting of the septum. So this is an open heart surgery, but nowadays a little bit incision have been done in the chest region and a flexible catheter have been inserted into the aorta region, and through the fluoroscopy or echocardiography, we used to visualize the catheter here. Okay, and after inserting the catheter in that region, we will cut that obstructed region. We will cut that thickened region of the septum that is bulging into the left ventricle. So at myectomy, we are cutting the muscle, we are removing the obstructed region of the septum so that the blood could easily flow from the left ventricle to the aorta region. Because this septum is bulged at the aorta region, at the left ventricular anterior part, okay, at the aorta wall, means the main pathway, it is blocking the main pathway of blood flow. So we are removing that obstructed or bulge out part by the incision or by cutting that part here. Next we have implantable cardioverter defibrillator. As we all know about the defibrillator, it will generate an electric current into the heart. Okay, so basically in cardiomyopathy, our muscles are damaging, our whole muscles of the heart are not working properly. Similarly, as we all know that our electrical system, our SA node, our AV node is present in the muscles region of the heart. So due to this cardiomyopathy, it is again impacting our conducting system. So we will place implantable cardioverter defibrillator into the patient body below the collarbone. So it is a small device which is placed below the collarbone of the patient. So a small incision is cut here and that device has been placed into the at the skin of the patient and below the collarbone. And this defibrillator will generate an electric current into the heart whenever there is a arrhythmic condition, whenever there is a bradycardia condition, means whenever the heart rate is below 50, then this defibrillator will generate an electric signal, a conduction to the heart for the contraction, for the systemic work, for the rhythmic contraction. Used for life-threatening. Okay, so defibrillator is used for life-threatening arrhythmia condition. It will continuously monitor our heart rhythm, which is very important to monitor the heart rhythm, and deliver shock when needed. So whenever there is bradycardia, the heart rate which is below 50, then it will deliver a shock to the heart for conducting or for contracting properly. Okay, so it will maintain the rhythm of the heart. Next we have left ventricular assist device. As the name suggests, it is assisting the left ventricle. So it helps to pump blood from lower chamber of the heart to rest of the body. So it is a pump-like device which is attached to the left ventricle region. So one part of this pump device is attached to the left side of the heart and one part is attached to the aorta region. Okay. So in cardiomyopathy, when the left ventricle have been dilated or when there is a hypertrophic happened in the left ventricle, then we go for left ventricular assist device. And if we are not able to receive a proper heart, a donor heart for the patient, then for a small time period or for a long time period, we can place a left ventricular assist device into the patient. So it's a pump device. Okay. So one end of this catheter, it is called as influx catheter because it is bringing blood from the left ventricle. So one end of the influx catheter is placed at the left ventricle and one end is attached to the aorta region. So whenever the blood will accumulate in the left ventricle, this blood will be inflow into this influx catheter and that pump will generate a contraction. This pump will generate a contraction which will send this blood to the aorta region and our whole body will able to get oxygen rich blood. Okay, so it helps to pump blood from the lower chamber of the heart to rest of the body. Next we have heart transplant. So it is a last surgical procedure. Whenever these surgical procedure get failed or all the medical treatment are not able to work, our heart goes into a petty form. Means when there is a adverse form of congestive heart failure, when there is a adverse form of cardiomyopathy, then at the last we do this heart transplantation. It is a big surgery. The name is very easy, heart transplant, but it is a very big surgery. Failing heart is replaced with a donor heart. So basically it is very tough to receive the donor heart. Okay, the patient the patient which is waiting for the donor heart have to go for many physical examination. There is a many blood tests, there is a many medical tests the patient have to go through, and we receive the donor heart after a lot of time. Okay, so it's a major surgery, it's a big surgery. It is performed last when all the medical and surgical treatment have been failed. So it is a last option. Other than this, we can insert a pacemaker into the patient for the synchronization or for the proper rhythm, for the conduction of SA node and AV node. And again, one more device we can insert into the patient, that is called as resynchronization device, which will help the ventricle to contract in a proper way. So this was the surgery for the cardiomyopathy. Next, we are going to study the nursing management of cardiomyopathy. So as a nursing officer, how you can manage the cardiomyopathy disease condition. So first point is conduct thorough assessment of patient's cardiac status. You have to assess all the cardiac status of the patient by checking the patient, okay, by visualizing the signs and symptoms of the patient, like does he have any dyspnea condition, is there any shortness of breath, or does the patient have edema or swelling in his body, is patient feeling anxiety, restlessness, fatigue condition. So you can assess the patient's cardiac status by checking his signs and symptoms, and by also doing ECG, EKG or echocardiogram diagnosis. Next we have monitor vital signs. It's very important to monitor all the vital signs of the patient, like BP, pulse, temperature, rate and rhythm of the heart. And next we have to check the fluid balance, because it is very important. In dilated cardiomyopathy, there is a congestion of fluid into the lungs and into the whole body. So you have to regulate, you have to check the fluid balance. You can maintain the intake and output chart of the patient. Next we have electrolytes level regularly. So electrolytes level like sodium, potassium, calcium, how our electrolytes are in our body. You can check through it blood test, okay, by doing the ABG test, that is called as arterial blood gas analysis, in which we check the carbon dioxide and oxygen level into our blood, and some bicarbonate level, potassium level, calcium level. So we have to regulate or check for the electrolytes. Next we have instruct the patients to reduce sodium and water. It is very important to restrict or to low down the intake of sodium and water, because sodium and water do a retention of water into the body, which will again increase the blood volume, and it will affect the heart workload. It will make the heart to work harder, okay, it will impact on the heart. So we have to restrict or low down the intake of sodium and water. Next, wait daily. It's very important to wait the patient daily because of the edema condition. Next we have consider the activity level, especially in children, younger adults. It's very important to notice the activity level of patient, mostly in children and younger adults. Why? Because hypertrophic cardiomyopathy is a genetic form of cardiomyopathy. 70% cases are from genetic. So in hypertrophic cardiomyopathy, it is mainly happen to the young adults, mainly to the young children. So do not do a physical activity a lot. We have to instruct the patient to take some pause in between his physical activity while he is playing some sports. So it is important to take the rest in between the physical activity. Next we have provide supplemental oxygen. If the patient is feeling dyspnea condition, there is some shortness of breath condition, then you can provide an oxygen supply to the patient through the nasal cannula or through the nasal mask. And this oxygen supply again will decrease the workload of the heart. and it will supply oxygen and nutrition to our whole body. Next, we have teach patients how to recognize worsening symptoms. If you are discharging the patient from hospital and you have given him some medicine and you have done his surgery, then you can teach the family as well as his patient. Okay, you have to teach the patient as well as his family about the worsening condition of cardiomyopathy, like if there is edema condition, there is shortness of breath condition, fatigue, anxiety, then you can immediately come to the hospital also. So we have to teach the patient and his family about the cardiomyopathy. Next, we have follow-up and monitoring. Follow-up is very important. In follow-up, we are checking how our treatment is going into the patient. Is the patient getting rehabilitated into the same condition? Is the patient heart is working in a proper way or not? Is our treatment is effective? So in follow-up, we are checking for the effectiveness of our medication, effectiveness of our treatment. And it's very important to monitor all the symptoms and all the things of the patient. Okay, so you have to do a complete follow-up of the patient. Next, we have provide emotional and psychological support as the patient is feel very depressed about the cardiomyopathy. So you can teach the patient about the meditation process, how you can do meditation, and how you can go to at spiritual level, and how you can divert your mind from the diseased heart. Okay, so we have to provide the emotional and psychological support to the patient, okay, by diverting his mind. Okay, next we have monitor for complications such as arrhythmia, thromboembolism, and heart failure. So due to the cardiomyopathy, there can be so many complications can come into the patient. So we have to check out all the complications of cardiomyopathy. And other than this, we can also teach the patient about the lifestyle modification, that he can take a heart healthy diet, and he can do some physical activity, and he can do some meditation, and patient can quit some bad habits like smoking and alcohol and cigarette. So we can do the lifestyle modification to the patient. So friends, if you really like this video, so please like, share, subscribe for more new updates. Thank you.